are constant since the reopening, including New York City, which we're watching very carefully. But we watch it on a day-to-day basis, and right now all the numbers look good. Within New York City, we look at the numbers by borough. We also look at the hot spots in the boroughs. We know that there are some zip codes that are much higher than other zip codes, so we also study those hotspot zip codes. The number of deaths is 17 today. This is right about where the lowest numbers have ever been. And again, that's more great news. And again, we don't want to see these numbers reverse. Number of lives lost on the 3-day average, again, is just about as low as it's ever been. So all the numbers are good. What we're doing works. Our approach has been vindicated, and the phased reopening by data works. I said from day one, I think these states and this theory of handling it politically, that people had a political theory of how to deal with a virus. You can't have a political theory on how to deal with a virus. You can't. It's a virus. It doesn't respond to political theory. It responds to science and data. So we're going ahead with our metrics and our phased reopening. 5 regions are set to enter phase 4 on Friday. Those are the 5 regions on the map. On phase 4, we have low-risk outdoor arts, low-risk indoor arts entertainment, museums, film and movie production, higher education, and professional sports. By the way, the spring training for the Yankees and the Mets starts July 1 in the great state of New York. I spoke with the Yankees and Mets organization today and confirmed that we are on track. And our health commission is going to be working with Major League Baseball on the protocols that are in place. Phase 4, we're going to increase the number of people who can be at a religious gathering from 25 to 33%. We'll also increase the number of people who can be in a social gathering from 25 people to 50 people. We are continuing to study malls, movie theaters, and gyms. There's new information that comes out on this virus every day, and anyone who thinks this is a static situation is wrong. So we're continuing to study the most recent developments. We're looking at what happened in other states. There's some reports that malls, bars, certain social clubs with air conditioning, that air conditioning may not be cleansing the air of the virus and just recirculating the virus. So we're studying that, and as soon as we get some more information, we'll make an informed decision. MTA subway system was up to the highest number of riders since this started. The MTA subway system, you know, there can be a silver lining in the middle of a storm. The system is cleaner than ever. I am a lifelong New York City boy, New York City person. And I've seen the subways. And we've had numerous discussions on how to clean the subways, and the subways are dirty and they should be cleaner. They are cleaner than they have ever been, period. Period. I defy anyone to find a time when the subways have been cleaner. Remember, we were talking about trying to clean them. Get out the old newspapers, coffee cups, etc. We were, for years, stymied to help the homeless who are on the subway system, which was really a terrible crisis for the homeless and for society. They are now cleaner than ever. They are literally disinfected. Forget cleaning. They are literally disinfected. And that is a positive that has come out of this. And I applaud the MTA for doing it. To disinfect the subway was not a simple task. You have to figure out how, what equipment, what technology, what's safe, what chemicals, what's safe for the employees to put down, what's safe for the riders the next morning. But they did it. On the reopening, we had a great debate in this nation as to how to reopen. Well, reopen fast, government shouldn't be in the way, this is all overblown, this is just the flu, reopen, reopen. Okay, some states did that. There was a different theory that I advocated, this state followed, which is it's a virus, don't use political rhetoric, use science and metrics, and phase the reopening by the data. The results are in. We tested both theories. The argument's over. Two different theories, we tested them. And now we know what happened. The reopening, done smartly, done intelligently, done on the data, is better for the public health. We saved lives, and it's better for the economy. It was never a choice between saving lives and reopening the economy. It was always, you have to do both or you do neither. The concept that you could open recklessly, see the virus transmission go up, and think that was going to be good for the economy was bizarro land. And you see that today because you see states with an increasing viral spread. It's up to about 27 states that now have an increase in the virus spread. And you see the stock market going down every time the virus goes up. Why? Because it was never one or the other. And now you see countries around the globe saying, we may not want to travel to the United States because of the virus. The only way to get the economy back was to have a smart reopening plan. That was always, always true. And now the proof is in the pudding because we're seeing it all across the board. And what New York is doing is counter to what you see across the nation. They are going up and we are going down. 27 states going up. So, nationally, we should admit the reality. Denial is not a life strategy. It never is. Those 27 states are going up. More people are being infected, and more lives will be lost. They're offering excuses. Well, it's because we're doing more testing that the numbers are going up. That is just factually not true. The numbers aren't going up because you're doing more testing. The numbers are going up because more people are getting sick. You know how more people are getting sick? More people are going into the hospitals. When more people are going into hospitals, you know what it means? It means more people are getting sick. And don't tell the American people anything different. They know that when people go to a hospital, it's because people are sick. And you look at Arizona, you look at Texas, you look at all these states. You know what you see? You see an arrow going up because it was misguided to say we're going to reopen the economy. What you're doing is you're putting people's lives in jeopardy and you're hurting the economy. New York is the exception. Dr. Fauci, who is in my opinion, one of the sane and smart voices in Washington, yesterday said that New York is an example of actually doing it right. In New York, we have to remain vigilant. Everybody has a role to play, individuals, businesses, and government. Look, this is a different moment in history. Government has to work now. This is not normal politics, political rhetoric, tweets. This is government actually having to perform a job. People expect government to work now. You see how engaged people are, how they're following government? and they know when it works and when it doesn't work. Their complaint with the federal government right now, they have been incompetent in how they handle the situation, because they have been. And local governments have a role to play. We have to keep that infection